Welcome to Learning Unit number 3. In this learning unit, we're talking about the specific role of nurses in health promotion and prevention activities. So let's enter into our learning unit and see what we're going to be learning about and accomplishing this week. So when you click on, again, it's taken you to what you're watching right now, the introductory video that I'm doing for you at this point. The next is an overview of what your learning outcomes are and your assignments. So again, I expect that you can read through these learning outcomes, and the assignments I'll be explaining about reading Chapter 4 in your textbook, your health promotion and nursing practice textbook. You're going to be completing an Institute for Healthcare Improvement, also known as the IHI module. Now, if you have not done an IHI module, you're going to be reading through the instructions about how to set up your account with the Institute for Healthcare Improvement, and I'm going to share those instructions with you. And then please note, this is free for students. Do not pay anything for completing these modules. So you're going to do a specific one, QI, Quality Improvement 102, how to improve with the model for improvement. So this is going to be the first part of your course, is in completing this. And if you've registered and done an IHI module in the past for other courses, then you'll know how to get on, but the instructions to remind you are still posted here. Your group projects, we're actually going to start working on our health promotion group projects in our next learning unit number 4. So in the meantime, you can look back and see who are your group members, who else signed up to work on the same group, either 2 or 3 people, and please share your contact information with your members. If you don't know them, please reach out. Make sure that you can contact by phone, by email, whatever, each member of your group. And then you're going to be doing learning unit discussion board. You're going to be doing a post, and remember, your first answers to the discussion board are always due by Friday evening. And usually I have a reply is required, but no reply is required this week because of the IHI module you're going to be doing, but please do read your group members' posts. So let's move on to the next spot. Now here is where I have put the Dropbox for the IHI module. When you click on here, you're going to have to upload either a screenshot showing that you've completed the module or the certificate that you get for each module that you complete. By the end of the BSN program, you will have completed all of the modules that are required for this IHI student certification. So it is a really neat thing to have, and these modules are going to be interspersed through your courses that you take for the BSN. So this is a place just to upload that, yes, I've completed QI 102. If you want to know the more specifics, then you go back up to the IHI Open School. When you click on the IHI Open School, which is between learning unit number 2 and 3, you're going to see that there's going to be 2 IHI Open School courses or modules for this course. The first one is due this week, and the second one isn't due until week 11, but you can complete them at any time. If you have not already registered for IHI, this is the link that's going to take you to the page with information about the open school access to the Institute for Healthcare Improvement. You've got to read these instructions very carefully. Please use the link where it says create your account on that page to register for IHI. It is free as you are registering as a student. Enter your contact information and click Next. When you register, choose Your role, they're going to ask you what's your role, student. For organization type, put institution of higher learning. And for your education, they're going to ask you about what's your education. You're just going to reply nurse. These, I believe, are all drop-down selections. You must use your Mercyhurst email. If you're already registered, you don't need to complete this step, but make sure that when you do register, you keep your password, as again, you're going to be completing many different modules throughout your BSN program. So once you've registered, this link here is going to take you to the Welcome to IHI Learning and Education page. On this page, you're going to click Browse Catalog. Then you're going to search the catalog for the course you want to complete. So for this case, it's going to be IHI, it's going to be the Quality Improvement course module. You must select student version. You're going to then enroll in that course. Then you're going to scroll down to the student version when it's asking you to enroll. Do not click on the option that says add to cart. If you click on the option that says add to cart, then you're going to have to pay. So you got to read these instructions clearly. So enroll is what you want. Now, once you've enrolled on this course, you need to come back and click on this link, and it will take you back to welcome again. Now you click on Learning Center, and this will allow you to launch the module that you just enrolled in. And again, this is for IHI module QI 102, okay? And if you have problems, here's a link to, and they'll help you out. And here again is the Dropbox for QI 102. And if you want to go ahead and work ahead of time, if you have time, you can do the same for module PS 103, not due until week 11, but you could complete it and upload your module there. So that's all under IHI Open School, which you can see is between Learning Unit 2 and Learning Unit 3. So now we're back to Learning Unit 3, and your assigned readings are Chapter 4 in your text. Next, you're going to do a video. It's less than 10 minutes, but you can stop the video at 8 minutes and 35 seconds. You've heard enough. And this is a video about community health assessments. And you're going to need to make sure that you view this video prior to doing the discussion board. You're also going to need to look at two other things. This is a brief Erie County, so we're in Erie County, Pennsylvania. In 2018, and yes, I realize it was 2018 because of COVID, they have not updated their community health blueprint. So this is the most recent data that's available for our county here in Erie, Pennsylvania. And what they're looking at is what areas need what lifestyle behavior changes, what prevention techniques, so health promotion, disease prevention need to occur most importantly in our county. So we have overarching challenges. A big one is poverty, and each one of your groups, except for the AIM group, those who signed up for AIM, that group number, which was what one? That was group number 4. Everyone else is really looking at a community, a group that is experiencing poverty. Along with poverty comes health inequity. Health inequity often comes along with any type of special needs. Here's a couple others that are important for a challenge for our county. But if we look at them even closer, you can see nutrition. Some of you are going to be working on nutrition, physical fitness, vaping or e-cigarettes, which could also go with tobacco or other substance use disorders. And you're going to see there's specific target populations. And nutrition and physical activity at this time that this study was done really reflected on adults. Now the data is changing and we're seeing an obesity epidemic, and especially in our youth. So we could even add a little bullet here. Nutrition in aging populations, so older adults, low income, really, again, as I said before, we have a county with some zip codes that are extremely low income. African Americans, LGBTQ, and also looking at whether urban or rural areas have this issue. So this is based on data that's been collected. Epidemiologists have reviewed this data. We'll look at it in its entirety in the future classes. But then we also have issues of obesity. Now you see obesity is also in youth. So as we're talking nutrition and physical inactivity, we know that this is also occurring with youth. Diabetes, COPD. So you can look down for disease prevention activities. Mental health, quality of life. We're going to look at that, especially in the group that is dealing with older adults and social isolation and poverty. We're going to look at that issue. So this is just a one-pager. If you want to print it out, it can be very helpful. So I just ask that you look through this a little bit further on your own, but I've just reviewed. Then, based on what group you signed up for, here are some links that I want you to look at. So for group 4, you're gonna come to a Mercyhurst University link about students with autism, the Autism Initiative. So this is our AIM program. For groups 1, 3, and 5, you're going to be looking at students in the Robert Benjamin Wiley Community Charter School. And you're going to look at why this group was selected for you. And you're going to read more about. So there's 2 different links that you can read and gather more data about why I have selected the Robert Benjamin Wiley Community Charter School. We're involved with it with a grant, and you can also read more about the school. For groups 2, 6, and 7, you're going to look at the information that, this is just one site, that is going to share about zip code 16501. So many of yours, the health promotion programs, if you're working on 2, you're working with Erie High School students. And the Erie High School services students that live in 16501. If you're working with older adults, you're going to see that there is subsidized housing, Mid-City Towers, that is in zip code 6501. And then you're also, groups 2 and 6 are going to be looking at this link about Erie High Schools. And what's important that you're going to find, as I brought up before, is poverty. In 2018, so a few years ago, but in 2018, zip code 16501 was the poorest zip code in Pennsylvania, in the state of Pennsylvania. There was the lowest income of residents who lived in this zip code area, and a high number of residents of any other zip code in Pennsylvania. So Mid-City Towers is in this zip code, and the schools that we are working with, from the high school to the Robert Benjamin Wiley Community Charter School, are also in service people who reside in this zip code. So poverty is key. And the median income, so median means the middle number out of all the incomes of people, residents who reside here, family incomes, the median income was 10,182. And I believe that was in 2021. So there is, significant need. If you're working with students in Erie High School, 100% of the students are low-income students. In the Robert Benjamin Wiley Community Charter School, 98% of those students are low-income households. So this is really important information because you're going to need this as you go forward with your health promotion program. Let's take a moment here. I know it's getting long, but let's take a moment to look at the discussion board. According to the video that you're watching on community health assessment, a community health assessment is a systematic way of identifying the needs, the priorities, and also the resources. I keep bringing up poverty. If your income for a family is $10,000 a year, you don't have many resources of a community using data and other information. This is an essential quote. So after you've watched that video, you've reviewed what we did kind of together, the Erie County Department of Health Blueprint, and you're looked at data specific for your group, which remember was right up here, those links that I provided for you. Answer this question. Here's a better way to look at it, sorry. What data did you find on your specific community? So is your community in 16501 zip code and or group, maybe it's the age of your group, older adults, children, that supports the need for your group's health promotion program. You don't have to reply. It's just a post by Friday evening, but concrete data. What did you find? Typically, when we do a community health assessment, yes, we do go for the data that I'm sharing with you, but we also involve the community. We find out, what does the community that we're looking at, what do they think their needs and priorities are? What do they believe their resources are? We've kind of cut that part out because I have gone forward with putting together some of the topics in communities. So this should all come together as we start down the path of developing a health promotion program specific in our groups. So have a great week and let me know if you have questions.